Hello, my name is Morteza Zabihi. I'm a machine learning engineer, and in today's presentation, I would like to talk about the different application of machine learning on acute brain injury care, the challenges, what are the gaps, and what are the steps involved in developing ML in this specific area. These are actually the area of our research lab that Dr. Rosenthal, as a director of ICU Precision Medicine program, has been actively involved in for many years. By leveraging data analytics tools like the AI and machine learning models, health professionals would be able to analyze a large amount of complex data and identify patterns that help them to make more informed decisions, predict outcomes, which help them to improve patient care, and also develop personalized treatment plans that can advance our understanding about the underlying patterns in the data. Before jumping to the different machine learning types of models and also the challenges that we are going to deal with, I would like to talk about the difference between the AI and ML. So artificial intelligence usually refers to the development of computer systems that have the ability to learn and can be used for problem solving, decision making. And the machine learning is actually a subset of the AI, and they are the algorithms that enables the machines to learn from data and improve their performance over time without being explicitly programmed. There are three major types of machine learning models. The first type is the supervised learning that tries to learn a mapping between the input and output pairs to make a prediction on unseen data. The strength is that often these models achieve a very good and high accuracy, but the weakness is that it's almost often it's very expensive to have human high quality annotated data. The second type is unsupervised learning. Actually, these models try to find the hidden patterns or a structure in the data without any prior knowledge of what is looking for. So the strength is that they can uncover the hidden insight, but the weakness is that often it is very challenging to provide a clear interpretation, and also they do not perform as well as supervised learning. The third type is reinforcement learning, that they're trying to learn through trial and error by receiving feedback in the form of reward and punishments. So the strength is that they can learn and adapt to the environment that is changing all the time, but the weakness is that they need a lot of computation and they may not generalize well compared to the previous two type of model in machine learning. So each of these categories have their own subcategories. Like supervised learning classification is one of the major subcategories of supervised learning. So one example could be when we have the clinical data and we would like to predict what is their coma recovery, or when we have the CT images of TBI patient and we would like to understand what kind of lesion that they have, and also segment and localize where the lesions happens in the brain. The other subcategory of the supervised learning is regression. These can be used to give us new insight. For example, examining the relationship between the various patient factors and the probability of their mortality. Clustering is the major subcategory of unsupervised learning. They can use to group similar trajectories of recovery of patients and group them into different subgroups, and we can, for example, go inside each group and find a similarity between those patients and also the difference between the patients in each group, which can help us to develop personalized treatment or kind of a patient-specific treatment strategy. The other type of unsupervised learning is dimensionality reduction. Imagine we have a large or big amount of data with lots of covariates. So we would like to do some kind of visualization for those. We can use these dimensionality reduction tools to help us to understand the pattern in the data when our data is big and we have lots of covariates. And also they can help us to identify the variables or the factors that has the most information or has the most contribution to the task of interest. An example for reinforcement learning is Could be an agent that is trained on a large data set of patient outcomes and treatment strategies to learn which strategy is the most effective at different times and for different patients. So, although also there are some challenges with the ML, specifically in acute brain injury care. The first one and the most important one is to need a large amount of high quality data. And for example, if you're using the supervised type of learning, we need also high quality annotation as well. So for example, if you are trying to develop a model to automatically identify different type of seizures, we need to have annotations from different annotators or human expert that also there is a very like the minimum disparity between their annotations. So this is one of the main challenges when we want to develop an ML model. The second type of challenge is risk of overfitting and bias, which is a very well-known one. And machine learning tends to learn the spurious correlation and noisy correlation. However, we are looking for the true correlations. And for example, if we have a subgroup of patients, they are in minority in terms of number of samples in our data, we would like to learn models that do not overfit on the other groups of patients and do not learn from that minority. So we would like, there's different methods to be able to answer this. This third one is the interpretability. We would like to increase the interpretability of a model, and we would like to understand when and why the model make a decision, so we can use it to make more informed decision, and also if it is wrong, we can use it and leverage from those information to make our model better. The last one is the integration with clinical workflows. Often the ML models are developed in lab, and therefore we have to see what kind of situation can happen in the real setting. For example, the missingness. If we are in the clinical setting, we are going to have missingness. Sometimes the mechanism of the missingness for different variables is going to be different. Sometimes, for example, the temperature of the patient is not going to be measured because the patient is like in a normal situation or it is not critical. And sometimes missingness happens because there is a specific lack of access to a specific modality, like for example MRI. So we need to first identify the type of mechanism and address them properly based on their type. So for example, one of the application of ML that we're working in our lab is to develop a model to continuously predict the coma recovery using the resting state EEG. So our model takes the data, the current data and the history of the EEG, and use those to predict what's going to happen in the future. So we are using this prediction of patient recovery trajectories and compute to the ordinal disorders of consciousness categories, and we are going to make them available for integration with other clinical contexts and also shared decision making. So machine learning development has several steps. The first step is data collection and preparation. It is obvious that we need diverse patient cohort. And also it is very good that when we are collecting data, we can consult with some statistician, data scientists, and machine learning engineers, so they would help us to understand what are the challenges and help us to provide a more and better quality data for machine learning development. The second step is actually the model development, is that we would like to develop a model that tailored to the specific application or the problem of interest that we would like to address. So for the previous example that I show, we are in our lab, we are trying a model that at each time looking at the previous EEG recorded and use this to predict the next 24 hours. And then we move 5 minutes forward through the time and then do the same process and so on and so on. So at each 5 minutes, we're going to provide what's going to happen in the next 24, 48, and 72 hours and provide this information for the medical staff. And they can also be used to inform the patient's family as well. So After the model development, it's very important to have a fair model evaluation to help us to understand when the model fails or when the model succeeds. So besides having a comprehensive list of evaluation metrics and confusion matrix, cross-validation also plays a very important role. So what is cross-validation? In a conventional form, we are randomly split the data into different folds, mutually exclusive folds, and then we're using all this partition except one for training and just kept one for testing, and we'll continue this process until all of these folds are being used or served as a test data. So this way we would be able to see what is the average generalizability of our model. However, if we have some kind of confounders in the data and some kind of a skewness in the distribution of those, it would be hard to address with this conventional cross-validation. So imagine that we have a minority of patients that have a specific kind of diagnosis or disease. So even if we are going to randomly split them, we would not be able to identify how our model is going to perform on those. So in our study, what we're doing in our lab, we are on top of the conventional cross-validation, we're using confound isolating cross-validation. So we stratify the data this time, not randomly, but based on the potential confounders. For example, in this application, we use age, time to admission, and also type of diagnosis. And then we train our model on every strata of data except one, and then use that to identify where our model fails. Actually, this is very important in this field because we would like to understand where the model fails actually, and where we should not let the model phase too much, because still we would like to that our model have a minimum promising performance even on a subgroup of patients. So this type of analysis is extremely important to be conducted when we would like to develop a machine learning model in this era. The next step is the model deployment. So this process of model development, even when we are deploying the model, continues. Then we're trying to monitor and evaluate and identify where the model fails or would not be able to perform as well as it works before. So at each steps, we are using the information that we gain at that steps and use it as a feedback to go to the previous step and make our model better. And this process continues. So there are still some challenges that needs to be addressed using machine learning in coma science. The first one is the continuous prediction of coma recovery, or basically continuous prediction. Majority of the models in the field are a one-time prediction. They're having a model at the admission and they predict what's going to happen in the 6 months. However, we know that the patients and the situation of patients are going to change drastically during their ICU stay. So we need a model to adapt to these changes and continuously predict this prediction based on the recent changes of the patient. The second one is the multimodal learning. So we have great models for example, CT image segmentation or MRI segmentation and classification. We have great models for the EEG classification, but we do not have too much model that would be able to learn the correlation between these information from different modalities and use them to make our prediction or classification task better. And the last one, and I think the most important one, the challenging one, and also the most interesting one, is the counterfactual explanation in machine learning models, that we would like to answer the what if question. So rather than having a treatment strategy and trying to find out what's going to be the output and predict the outcome of the patient, it would be great to understand what would happen if we are using an alternative treatment strategy on the patient, and which alternatives is going to give us the best result, and then use that. Thank you so much for your attention.